And we are starting the head to toe assessment. Did vital signs, weight, BMI, no allergies noted prior to her coming in. When she walked in, her gait was normal. Um, her no involuntary movements noted, standing erect. Positive mood, smile on, sitting relaxed with her hands in her lap. She has responded cooperatively and appropriately. She is dressed appropriately for the situation. She is clean in appearance, hair is clean. Um, okay. All right, so we'll start this. Um, Washed hands, provided privacy. I did explain the procedure to her, and you agreed to the head to toe assessment. Okay. Innocent allergies. Okay. I'm going to start with the head first. The hair. And I'm going to look through the hair. Hair is evenly distributed, long, healthy, clean. I'm going to look at her scalp and inner hair. No scale, no scaling, no nits, no inhabitants. Any tenderness or anything noted? No lesions or abnormalities noted on the scalp. Okay, I'm going to run my finger down face and scalp. You just tell me if you could feel that. Yeah. Okay, and then it's testing cranial nerve 5, which is your trigeminal nerve. Can you smile, frown, squeeze your eyes together? Okay, facial nerve 7, cranial nerve 7, facial, test it there. Okay, and I'm going to, you see, okay, maxillary or frontal sinuses. Can you feel that? Yeah. Does it, any tenderness? No. Maxillary sinuses, any tenderness noted? No. Okay. Head is normocephalic. It is symmetrical with the body. No abnormalities noted. Skin on the face and the body is evenly distributed. No lesions, no abnormalities noted, no rashes, no lumps or anything noted. Freckles noted to entire body. No irregularities noted. Skin turgor, less than 2 seconds. Skin is smooth. Smooth in texture. No lesions or anything. No edema noted to lower extremities. Hands noted with no calluses, no thickened skin, no dryness noted. Let me see your capillaries. Capillary refill, less than 2 seconds. Nails are noted smooth, no ridges, and pink in color. All right, and we're going to do the eyes now. Her eyes are symmetrical with her face. No drooping noted with her eyes. Eyelashes are evenly distributed. I'm going to check her lacrimal glands. Okay. No redness, no irritation. They seem moist. No abnormalities noted with that. External eyes, No abnormalities, no lesions, no redness noted with them. Internal eyes, um, the sclera is white, conjunctivus noted with no redness, no irregularities, no lesions. Inside of eye is moist. Pupils are 3 millimeters, dilating and constricting, which is the oculomotor. Um, actually, cranial nerves 3, 4, and 6, which is your oculomotor, your trochlear, and your abducens cranial nerves. And move your eyes side to side, and then up and down, and then lateral movements. Okay, so those cranial nerves are intact. Then I'm going to test her cardinal field of gaze. So just watch my finger. Good, good. So eyes are, pupils are equal, round, reactive to light. Accommodation. If you'll watch my finger as I bring it to your nose, and accommodation. So eyes are parallel. Um, the optic nerve, cranial nerve 2, we tested that with the Snelling chart prior to coming in here. She stood 20 feet away. So we tested that optic nerve, which is cranial nerve 2, prior to coming in here. Um, okay, did the pupil dilation. Okay, um, we'll go ahead and go to the nose. Nose is symmetrical with her face. No lesions, no abnormalities noted with the external nose. Um, no septal deviation noted. No drainage, no redness, no swelling noted on the internal nose. And then what we're going to do now, if you will, let me grab a Kleenex. Okay, if you just want to make sure your nose is clear on both sides. Okay, do this and just make sure you can breathe. Okay, absolutely. Good. Okay, and what we're going to do now is we're going to smell, which is the cranial nerve. Yeah. No, it was the olfactory, cranial nerve 1. I don't know why I was trying to make it difficult. Okay, if you will occlude one side of your nose, and I will do a sense. Really? Okay, and if you will occlude the other side. Mhm. Good. Okay, so, and that was cranial number 1, olfactory, and that's with the nose. Um, lips. Lips are noted pink, no abnormalities, not dry, they're moist, no problems with them, no lesions, noted with her lips. Okay, and if you'll stick out your tongue, tongue is pink and moist, and I'll feel. I'm sorry, I know. no lesions noted. Stick your tongue out and move it right to left. Okay, and that is testing her hypoglossal. Hold on, let me think. Yes, cranial nerve 12, which is her hypoglossal. Um, where's the glossopharyngeal is the gag. Okay, so hypoglossal, moving the tongue right to left. And then let me look inside. Okay, looking at tonsils, tonsils, no redness, no lesions noted. 1 plus. Uvula is midline, no swelling, abnormalities, lesions noted. Um, hard palate noted anteriorly, ridges noted. The soft palates in the back is smooth and moist. No lesions, no abnormalities noted. Let me check the inside. Buccal mucosa is pink and moist. No lesions noted on the buccal mucosa. Teeth, okay, open. No abnormalities noted with teeth. No cavities. No infections. No signs of inflammation. No redness to the gums. Gums are moist and pink. And if you will open your mouth and say ah,
Ah,
okay, and we're testing the glossopharyngeal, which is oh, 9. Um, cranial nerve 9. Glossopharyngeal by having her say ah, and then our uvula moving up. And if you can swallow for me, that is cranial nerve 10, which is your vagus. Okay, then we're going to go to the ears. Okay, external ear, no lesions or abnormalities noted. Skin color is the same as the facial color. Tragus, any tenderness noted?
no.
Good. Pulling the auricle, any tenderness noted with that? Okay. Internal ear, no redness, no drainage, no lesions noted in the ear or outside of the ear, no abnormalities noted. And we, let me cover this ear. I'm going to whisper, and the whisper test is the acoustic, which is acoustic cranial nerve 6, acoustic. So we're going to do the whisper test.
Banana.
And then we're going to do this one.
Apple.
Okay, good. And that's just in your acoustic, your cranial nerve 6. Okay, now we're going to go to the neck. Um, neck muscles, symmetrical. No abnormalities noted. Any tenderness?
No.
Okay. No tenderness with the neck muscles. Okay. And I'm going to palpate carotid artery on both sides. Good. 2 plus on the carotid artery. Left. 2 plus on the right carotid artery. Now I'm going to listen to see if I can hear any bruise. Hold your breath for me. Okay, take a breath. Okay, hold your breath for me. Okay. No bruise noted with the carotid arteries. I'm gonna do the lymph nodes right now since we're in the neck area. So we have your pre-auricular, post-auricular, occipital. Then you have your deep cervical chain. You have your superficial cervical chain. No, you just have your cervical chain. Superficial, then you have your deep cervical chain, cervical, deep cervical lymph node. Then you have your supraclavicular lymph node. It's right above the clavicle. Then you have your jugulo-digastric lymph node, supramandibular lymph node, and your submental lymph node. Okay. Trachea is midline, no nodules, no irregularities noted with the trachea. Okay, we're going to test your trapezius muscle, which is testing the spinal accessory, which is cranial nerve 11. So I'll place my hands right here and then push up. Good. And that's testing your spinal accessory cranial nerve 11. Okay. I'm going to go ahead and move to your lungs. We are going to auscultate first. Okay, and with the lungs, we have 3 lobes on the right, 2 lobes on the left. I will be listening, starting on the right side. We'll be starting up in this area, and we will be moving in this fashion, right to left, until we get about right here. And then I'll listen to the lower lobe, right up under the breast, and then the lateral lobes on the sides. We'll listen to your neck first. Breathe for me. And what we hear in the neck are the bronchial sounds through the neck area. Okay. Breathe for me. Okay. Good. Okay. 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 And the sounds that I hear up through here are bronchiovesicular sounds that I hear through this area. Okay, then we're going to go down here. Okay. Good. Good. Now the lateral. Okay. Good. Okay. Good. And in this region off to the side, you hear vesicular sounds, bronchiovesicular, and bronchial sounds. Can you turn your back to the camera? And we'll go ahead and listen to lung sounds. You'll have to turn sideways and then turn so your back's to your. Oh, you see what I'm saying? Sorry. Okay. And we'll listen on the back. Okay. Go ahead. Breathe. Okay. Breathe. Good. Okay. Okay. Breathe. Good. Breathe. Breathe. Okay. Okay. And what I hear in here is your bronchiovesicular sounds. And then lower lobe. Good. Good. Deep breath. Good. Mhm. Good. So while she's got her back here, I'm going to go ahead and percuss. So the percussion sounds that we're going to get are is going to be over the bone areas. You're going to hear resonance down the middle in between your scapula bones. And then once we get down in this area, we're going to hear dull sounds because we're going to be over organs down in this area. So that is a flat sound. We're over a bone. Resonance in this area. Good. We do. Dull sound in this area right here. So you have resonance here and kind of a dull sound in this area. And then, of course, you get flat over the bone areas. Um, okay. Okay, and then I'm going to percuss the front also. Okay, you hear resonance right in this area. You hear resonance throughout here. And still over a bony area right there. So we will go. And you're kind of a dull on that side and there. Okay. So now we went over the long fields, now we're gonna look at the heart. There's areas with the heart um, that we're going to listen to on here, and I will um, pinpoint what area that we're going to be in to listen to the sounds first, and then I'm going to flip my stethoscope over to the bell to listen for murmurs. Um, and I did know that in the herbs point, you will not hear any sound, no murmur or anything over herbs point. Um, Once I get her to the bed, we will palpate the point of maximal impulse along with the apical, your apical and your radial pulse at the same time to kind of get a reading on that. Okay, so we're going to come down. This is your aortic valve. Good, S1, S2. This is your pulmonic valve. Good, S1, S2. Then you're going to go down from here. You'll go down to your third intercostal space. That is your earth point. S1, S2. And then we're going to go to your tricuspid, which is your fourth, which is what some books say, and then some is fifth intercostal space. But your fourth is your tricuspid. And then we're going to go, so your fifth intercostal should be about right there, and then mid-clavicular. So we will move over. That is your mitral valve. Good. S1, S2. Okay. And then I'll flip it over to the bell so we can listen for murmurs in the same fashion. Okay, we're in the second intercostal space, aortic. No murmur heard. Pulmonic. No murmur. And what the next one is your herbs point. You're not going to hear a murmur in that area. Now your tricuspid. No murmur. And then we're going to go to fifth intercostal space, mid-clavicular line. And no murmur heard in that area. While we're here, we're going to do the upper extremities. Hold the hands. Sorry. Grip. Good grip. Good strength. Okay. And then hold the hands. Pull. Good strength. No muscle wasting. Noted. Good strength bilaterally. Upper extremities. Okay, if you could move your arms, shoulders up, that's abduction, and then bring them back down, that's adduction. And then move your shoulders up, and then extend. There you go. And then back up. And then bring your arms behind your head. Good. And then, if you will, lean up a little bit. Anytime you, and if you can put your arms down bring your arms behind. Well, you can reach just fine right there. Okay? And then we're going to do arms out in front of you, straight, and then have you move your wrist side to side. Okay? Up and down. Okay, fingers. Good. And then your wrist. Bring without movement. Try to do your wrist in with your thumbs. Good. Good movement. Move it for crepitus. Okay, move on. Good. No crepitus noted. Wrist joints. Okay, moving in and out. No crepitus noted in the elbow joints. And then move your shoulders up. Move your arms up. No crepitus noted in the shoulder joints. Skin on the arms, no lesions or anything noted with that. We did the fingernails smooth, no ridges, pink, heavily refill. We did that. We did lungs, front and back, percussed, heart, breast, breast. I need to do that motion. We're delirious at this point. So, when I did the breast examination, I would have her put her hands on her hips and lean forward, and then I would have her raise her arm as I'm doing a breast exam. And how I would do that, if she would raise her arm, I would start right here in the talus stance and do a vertical and go up and down until, and I do a circular motion just to check for lesions. No lesions, no dimpling, um, no rashes, um, no lesions, dimpling, no abnormalities noted. Nipple area, areola in between your two forefingers and your thumb, roll. No abnormalities noted with that. No discharge noted. Breasts are symmetrical to her body bilaterally. Lymph nodes in the breast. So you have your pectoral lymph nodes, you have your central axillary lymph nodes, then you have your lateral lymph nodes, and then you have your pectoral, central, lateral, and your deep axillary lymph nodes in your breast area. Sorry, it's late. Okay. We'll go ahead and do the abdominal. And if you would, make sure you just look at the camera if you don't mind to make sure myself is not in the frame so they can see. Okay. Okay. As I'm looking from the side, sit is flat. And I'm looking from the feet up. Abdomen is symmetrical with the body. I do note side A present across the abdomen, vertebra, noted also. Skin is smooth, no lesions, no rashes noted, no abnormalities, except for the striae and the linea nigra noted there. Um, Lower abdomen, C-section scar is horizontal, no abnormalities, no redness, no signs of inflammation. It is well approximated, um, healed appropriately. What I'm going to do first, I'm going to auscultate first with the abdomen before I touch her, before I palpate or any of that. And the way I'm going to do it, I'm going to start in the right lower quadrant. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, and active bowel sounds noted in all four quadrants. Now I am going to percuss in all four quadrants the same as I auscultated. Right lower quadrant, and the sound you hear is timpani. It's almost like thumping a watermelon. Not sitting in your tummy, it's a watermelon. Upper quadrant, left upper quadrant, left lower quadrant. So you hear timpani sounds whenever you percuss. I'm going to do it with right palpation. Right lower quadrant. Tell me if there's any tenderness. Right upper quadrant. Upper quadrant. And then left lower quadrant. Okay. No tenderness noted, no lesions noted, no rigidity noted, no abnormalities, no masses palpated in the abdominal region. Okay, since we're here, we will go ahead and do lower extremities. Skin is even, no masses, no lesions, no rashes noted, no edema. I said that. Delirious. Let me get to there. Make sure you see what I'm doing. Okay. All right. Try and push up. Good. And then straight is good. Bilateral is equal bilaterally. And then what I want you to do here is try to move your legs out. Good. Straight is equal bilaterally in the upper. So feet. No calluses, no lesions, no abnormalities noted. Toes, capillary refill, less than 2 seconds. Toenails noted, smooth, no ridges, pink in color. No abnormalities noted with that. Okay, move your ankles around. Good. You want to feel? How to do that? Good. No crepitus found. Noted in the ankle joints. Move your toes. Good. And if you could move your knees up, bend your knees, and then flex them back out. Okay. No crepitus noted in the knee joints. Babinski. So what I'm going to do here is just test the Babinski, and of course our reaction that we want is negative. Okay, and see how she flexed her foot. So that is a negative Babinski reflex that we get right there. Um, okay, while I'm down here, I'm going to go ahead and do the pulses in her feet. And I'm going to go ahead and test the deep tendon reflexes. So first, I'm going to palpate the dorsalis pedis pulse, which is, do both up down. Can you see where my fingers are? Dorsalis pedis pulse. 2 plus bilaterally. And then if you move this one over. So what I'm going to do here is your, let me think. Hold on. There's a pulse. Let me just test it first and it'll come to me. Okay. Okay. And those pulses are 2 plus bilaterally. I'll think of the name in just a second. Tibial pulse. Is that correct? Okay, we'll go with that for now. And then your dorsalis pedis pulse. We'll do your deep tendon reflex when you're sitting in the chair with that. Patellar, popliteal. If you'll just move your leg, not all the way up yet, like that. Okay, we're going to feel the popliteal pulse, and it's behind both knees, which is in the popliteal fossa, and it's pretty deep in up under the knees, and they are 2 plus bilaterally. And I'm going to put the femoral pulses while she's laying down, okay, which is in between her groin and pubic joint. Okay. Femoral pulses are 2 plus bilaterally. Left side. We lay on your left side. Okay. Turn this way a little bit. What I'm going to check now is her, well, you know what? Turn it this way to where they can see where, I'm going to check your ankle pulse with your radial pulse. Left side. Okay, and what I'm gonna check now is the point of maximal impulse, which is the apical pulse, and I'm gonna check it with the radial pulse, which is on the radial side. Okay, and they are equal. I would do that for 1 full minute, and then I would get the reading for that. But they are equal with each other, the apical and the radial pulses. Um, okay, we're going to come back over here and the abdomen. All right, and scoot back just a little. Don't sit down just yet. Okay. Sorry. All right. If you recall, I'm going to test the hip joints at the waist, side to side, front to back. Okay. Let me get good. Let me get okay. Mm. Okay, then side to side. Okay. No crepitus noted. Um, no muscle wasting noted in the lower extremities either. Um, okay. With her back, if you will turn, we do note in the cervical region that is concave, thoracic is convex, and then lumbar is concave. And if you'll turn to the side and then bend over and dangle your arms. Okay. And there, I do not note any scoliotic deviation with that. Okay, you can stand back up. But it's all right. So back scoliotic deviation. Okay, I have a seat pulled up some so you can see. Okay, what I'm going to check now are the pulses bilaterally. Just lay them down. What I'm going to check are the brachial pulses. And the brachial pulses are 2 plus bilaterally. Then I'm going to check the brachioradialis, which is on the thumb side. And it's going to be down from the thumb. Brachioradialis is for the deep tendon, the radial pulse. 2 plus bilaterally. Then I'm going to check the ulnar pulse, which is on the pinky side of the arms. Good, and that is 2 plus bilaterally. We did the pulses, the tibial pulse is medial below the medial malleolus. They were 2 plus bilaterally, dorsalis pedis, popliteal. Okay, deep tendon reflex. What I'm going to do now is test the biceps, deep tendon reflex. So if you'll just, you can just leave it down this time. So what I'm going to do is find her biceps tendon. which is right there. I'm going to put my thumb there, right there. And what we should see is a reaction in the arm. You see that movement in the arm right there. And then next we're going to do the triceps deep tendon reflex. And if you'll just angle your arm to the side, just angle it, just relax. Here you go. Deep tendon is your elbow on the exterior of your elbow. Just right above it is your triceps. So we are going to see if we can get a reaction. See, you see that little movement in her arm. Okay. Can you sit your bottom back further in the chair to where your legs just dangle? Okay, and I'm going to check the patellar reflex. So this, her feet are dangling in the chair. And what I'm going to check right there is her patellar reflex, which is right below the knee joint. Okay. And we saw movement in that foot. And then I need to do the Achilles. And it's just in. Okay. So what we're going to do now, I'm going to hold her foot up, kind of flexing. Her Achilles is, okay, let me show you where the Achilles is back here on the back side, on the lateral side of her foot. And what I'm going to do is flex her foot while I'm testing the Achilles tendon. You see that reaction that we got out of the Achilles tendon. While I'm down here, let me see if there's anything else before I get up. We did movement in the joints of your ankles, your knees. No muscle wasting, no crepitus felt, no lesions, no abnormalities, skin tone and color. Good turgor. Okay. Now let me get up. Okay, we did waist up. Okay. Now we are going to do, let's do sensory. So what I'm going to have you do is close your eyes, and tell me if you feel sharp, dull, or soft, which is just going to be like a little wrist. Okay. Sharp, soft, soft. Sharp, dull, dull, sharp. Sorry. Okay. Now what we're going to do, we're going to check her cerebral function. So on your legs, at the same time, I want to see you tap your legs, and you're going to do it at the same time. Front and back. Good. So bilaterally, she's equal, no irregular movements, no involuntary movements noted. What I'm going to have you do now, I'm going to put my finger out here. You're going to put your hands out here, touch your nose, and then I want you to touch my finger. And then for each one, you do that. Good. Okay, if you want to slide the chair away, I'm happy to. Okay. Have you touch your shin to each leg and rub down the front of your leg. Good. Next one, just rub down. There you go. Okay, and now if I can have you stand back and tandem walk heel to toe. Good. Standing erect, no involuntary movements, no swaying. With her cerebral function is intact, of course. She did very well in that. Um, with breast, abdomen, scars on the skin, just in case I didn't mention, I did target smooth freckles, no lesions or anything noted. Um, not sure if I covered tattoos. She does have a tattoo on the back of her neck, on her wrist, lateral abdomen. Okay, so we did that. Okay. And I think what we have left is female genitalia. Um, pubic area noted with coarse, curly, dark hair, evenly distributed, with no nits, no rashes, no lesions, no inhabitants noted. Um, palpated for any nodules or irregularities. Um, no nodules, no swelling, no signs of any rashes noted. Labia majora noted with no bulging, um, symmetrical, um, no lesions, no redness noted, labia minora, pink, soft, no swelling, no discolorations, no bruising, no abnormalities noted. Urethral opening is a slit midline, noted with no redness, no bruising, no abnormalities noted, no drainage noted. Um, Vulva noted with no bulging, no irregularities noted, no lesions. Um, Anal area noted with no lesions, no skin abrasions in the area, no hemorrhoids noted in the anal area. Male genitalia, inverted triangular, hair, region of hair, coarse, dark curly hair, evenly distributed, no rashes, no nits or inhabitants noted, no lesions noted, no palpation, um, penis palpated with two forefingers and thumb, no lesions or irregularities noted, no rashes, no dryness, flaking, no bruises. Noted, penis noted with no hair, wrinkles, urethral meatus is located centrally at the top of the penis with no redness, no lesions, no drainage noted upon palpation. Scrotal area, noted soft and spongy, testicles noted and bilateral. Inguinal opening, follow the scrotum on the underside with no abnormalities noted, no lesions, no inhabitants noted on the posterior side of the scrotal area. No evidence of hernia noted in the inguinal area. Rectal exam performed with male laying on the bed, fingers lubricated, inserted in anal canal, and then turned towards the scrotum. Area is smooth, no irregularities noted. It is firm and heart-shaped. No evidence of any hemorrhoids or irregularities noted in the anal area on the male. I think that is the end of our 20th head to toe assessment. Thank you so much. I have washed my hands and I have made sure that she is safe in the area that she is safe in. And I've given privacy for her to get dressed. And I've thanked her multiple times over and over and over and over for coming and doing this with me again. Thank you guys.